Live from ABC 7, this is Eyewitness News in high definition.
Doctors are looking for your help to treat hearing loss.
Up next, we're going to take you inside a Southern California laboratory where researchers are trying to learn more about what causes deafness. How you can help with today's Healthy Living Report.
60 different genes can lead to hearing loss, but researchers are just starting to decode them. Much of how disease affects the ear remains a mystery.
Now local doctors are turning to the public to try to get some answers. Health specialist Denise Tador explains.
The secrets of the ear and curing hearing loss lie in and around the temporal bone. The temporal bone is the hardest bone in the body. It sits on the side of the skull. It encases the inner ear, the key to hearing and balance. The research can only be done on donor temporal bones, and there used to be 36 active temporal bone research labs in the country. Now there's only 3. The remaining one here in Los Angeles at the House Research Institute needs your help to continue to help others.
When did we do your surgery?
It's been a month since surgeons implanted a cochlear device into William Rothwell. Noise-induced hearing loss caused him near deafness. He's amazed at how well it's working.
Marvelous, benefiting daily.
How the implant continues to work as William ages is one of the many things scientists at the Temporal Bone Lab at the House Research Institute are studying. It's the only way researchers can find out precisely how disease and injury affects hearing.
The examination of the inner ear isn't a part of the routine pathology.
90-year-old Dr. Fred Linthicum is part of the House research team that discovered the cause of hearing loss from otosclerosis, an abnormal middle ear bone growth.
Because of that, a surgical correction was devised for it, and now all of those people who get a hearing loss due to otosclerosis can have their hearing restored.
The team is also working on identifying the genes that cause hereditary hearing loss.
It could potentially lead to therapeutic treatments in the future for patients with this type of deafness.
The incision looks very good.
The long-term effect of the cochlear implant on William's auditory nerve is something researchers would like to examine up close. And since he is the beneficiary of research, William is thinking about being a donor.
Considerably in favor of it, and it will probably, it calls for a sign-up, doesn't it?
People who decide to become temporal bone donors receive a free hearing test from the House Clinic every 5 years. It helps establish a medical record that can be studied for future generations. In Los Angeles, Denise Tador, ABC 7 Eyewitness News.
The House Research Institute is hoping people from different ethnic backgrounds will become temporal bone donors, since many hearing loss conditions affect people of color differently. To find out more about the Pledge program, go to our website at abc7.com and click on Help.